Postpartum depression. So let's start by talking about some myths. Number 1, it is less serious form of depression. No, it isn't. Number 2, only moms have it. No, dads can have it as well. Number 3, it has no treatment. That's totally incorrect. Postpartum depression has treatment like other forms of depression. Number 4, you cannot do anything to prevent it. No, some of the risk factors are preventable. Number 5, it is caused only by the hormonal changes and every mom has the same level of depression and anxiety. No, that's not correct. It is caused by a number of risk factors and every person suffers differently like any other form of depression. Number 6, it will pass soon. No, it won't pass soon without treatment. That is called baby blues and that ends in 2 weeks' time. If it is not ending, you need help. You need some strategy to cope with it. Number 7, if it is your second pregnancy or to the first pregnancy, the chances of having PPD decreases. No, after your first, if you have it in the first pregnancy, the chances of having it in subsequent pregnancies increase by 30%. Number 8, you should not talk about it because it's something that comes as a package and every mom has it. No, that's not correct. You need to talk about it and you need to seek help if you are struggling with it. Let's quickly discuss what postpartum depression is. So after giving birth to a baby, you can feel low, sad, anxious, irritable, sleep deprived for 2 to 3 weeks. That's totally normal and it's called postpartum blues. A lot of moms, every mom has postpartum blues. That's totally normal. But if this depression lasts beyond 2-3 weeks and if you started feeling hopeless, guilty, have suicidal thoughts, have thoughts of harming your kid, or if you start withdrawing from all the social interactions, if you don't find joy and happiness in anything, if you don't feel like doing anything, if everything becomes purposeless for you, that's a red flag. That's called postpartum depression. And why it's need attention is because this depression can develop into psychosis. There are a couple of risk factors that can lead to postpartum depression. It's not just the hormonal change. There are a couple of things. You can read about the things in the caption, but I'm going to talk about one of the risk factor that's preventable and nobody talks about it, and that's unplanned pregnancy. That's your false expectations about yourself and your baby. So when you talk to the women around, one of the common reason of going into depression is because their expectations are not being met. They wanted a baby to stabilize the family, but it's not getting stabilized. They wanted a baby so that the finances will get fixed. No, honey, it's not getting fixed. Okay, they wanted a baby because the society wants a baby and nobody is here now to help out. So when you are in a marriage, when you are planning to have a baby, sit down, settle down, think about it. Think how to manage the baby, how you're going to manage it, who's going to be your support system, how you're going to manage the finances, what about your studies, what about your career, how long the break going to be, how long you're going to stay at home. Think about all these things rationally and plan accordingly so that your expectations are met. And obviously, the newborn who is coming into the world is coming with certain expectations from you. Needs your time, needs your attention, needs you, needs the mom, needs the dad. Obviously, needs a family. He's coming with the whole package with it. So be prepared for the package so that you don't get any surprises. And to be very honest, this is not the only reason why people go into depression. Depression is something really serious and it can be because of certain risk factors, as I mentioned earlier. And of course, there are a few treatment options, there are a few management strategies that you can also adapt. And if you are struggling with this postpartum depression, there's nothing wrong in it. It's a form of depression. It's not less serious than any other kind of depression, and you do not need to keep it to yourself. You need to speak about it. You need to seek help about it. So there are certain things that you can do if you are struggling with postpartum depression. Number 1, you can have some psychology therapy. You can even talk to a friend, talk to family. So if you're in a country with your family, it's very good. Ask for support. If your family is supportive, wonderful. That's a brilliant thing. Ask for help. ask them to help you out and support you so that you can spend some time with yourself, and you can sleep, you can look after yourself. But if you are in another country away from your family, there are a few things that you can do. Like for example, if you're in UK, US, Australia, Canada, anywhere in a developed country, what you can do is ask your GP for help. They're not gonna always start you on some antidepressant or antipsychotics, but they can offer you some psychological therapies that you can talk and get the load out of your chest. Or they can liaise you with different support groups. Through them you can interact different other parents, go out with them, interact with them, socialize, and this will really help you to get back to your life. And if none of the psychological therapies work, and even if the support system is not working, then there is nothing wrong to have medication. All medications, I agree, have side effects, but you have to weigh the benefits and the side effects. So if you're really struggling with it, talk to your doctor, get a specialist, and get it sorted, because in the long run, you're gonna affect yourself, your kid, your newborn, and your family, and it's not a nice thing to suffer alone. I hope you all have a nice postpartum period.